This course presents a proven, systematic method of contouring porcelain anterior bridges. The course is designed to help you learn to produce anatomically correct and aesthetically pleasing anterior bridges in a very short time. With this step-by-step process as a foundation, you'll go on with practice to develop a high level of craftsmanship and personal satisfaction. If you already have experience with other methods of contouring bridges, these techniques will help you reach even greater levels of precision, craftsmanship, and productivity. The course includes the program you're watching and a second one. This guide is a condensed outline of the steps in the contouring procedure. When you begin to contour bridges, use the guide as a reminder of the steps in the process. The two demonstration programs will show you the complete contouring process. In the first program, you'll see how the basic anatomical features of the teeth are created. The second program will show the final contouring and staining of the finished bridge. After you've watched the first program, you'll contour the bridge to produce the basic anatomical features. Your supervisor or instructor will then check your work for accuracy. When you've completed the basic contouring satisfactorily, you'll watch the second program. Then you'll finish contouring the bridge and stain it. If you have any problems in contouring the bridge, your supervisor or instructor may suggest that you watch the first or second program again and then try another bridge. And while you're developing your skills, you may view the programs again as often as you wish. Before we start the demonstration, let me explain some key points and tell you what will be expected of you. There are 5 key points to keep in mind. First, the bridge work you'll be contouring is built to size, with no more than 0.5 millimeter of excess porcelain in critical areas, such as the labial surface of each tooth. If you find that you must grind more than 0.5 millimeter in these areas, notify your instructor or supervisor, as the bridge work is overbuilt. You'll not be able to achieve a pleasing appearance in the finished bridge, because you'll have to grind away the vital surface of the porcelain. Second, fired dental porcelain has a somewhat shiny, reflective surface. When you contour the porcelain with an abrasive tool, you grind away this reflective surface. The difference between ground and unground areas is subtle, but clearly visible when you look closely at the porcelain. This difference is important because it shows you where you have ground and where you have not ground, and it'll guide you in future contouring. Third, it's important that you learn what each type of abrasive point is used for, and what effect each one has on the porcelain. As we go, we'll tell you which stone to use for each step. Notice when you use the stone what effect it has where it contacts the porcelain, and how the edges of the contact area create illusions by reflecting light. These points lead to the fourth key element, which is aesthetics. Your objective is to create an aesthetically pleasing bridge, one that has the natural, lifelike appearance of anterior teeth. To do that, you must contour the teeth to the correct size, shape, and texture, and then apply selected stains to achieve the correct individual color characteristics. As you'll see, very subtle touches with the grinding wheel and staining brush can produce very pleasing, realistic results. The most important aspect of aesthetics is the light reflected by the contoured porcelain, because that is what the eye sees. Part of the skill of contouring is the ability to visualize shapes in the bridge. And while you're learning, you'll mark the bridge to guide your eye. This procedure is designed to enable you to greatly improve your ability to produce anterior bridges and crowns. Others who've completed this course have been able to produce over 1/3 more units per day. However, don't expect a dramatic increase in production immediately. As you gain experience and skill, you'll find yourself producing more and more units per day. But take your time in the beginning and make sure you understand what you are to do at each step. When you begin to feel familiar with the steps, notice how long it takes you to contour a bridge. You'll find that it takes less time each time you do it. The model of the finished bridge represents the level of quality you can expect to achieve. Quality is defined here as each tooth having all of the anatomical features consistently found in natural teeth. You'll also be able to identify and construct all of the anatomical features shown in the printed guide. Visualize the effects of all abrasive points and understand how they're used. and perform the step-by-step procedure consistently. Now let's begin our first demonstration. First, read the work authorization or prescription, and make sure you understand fully what the doctor has requested. If you have any questions, do not proceed until you get them answered. We start with the preoperative model. This model is made from the impression the dentist takes of the patient's teeth before he prepares the teeth. The preoperative model tells us what the teeth were like before they were prepared and what relationship the teeth had to one another. First, we'll establish the midline. Place the preoperative model on the opposing or lower unprepared model. Notice the midline where the upper centrals come together. Use your red pencil to carefully extend that line down along the labial surface of the lower teeth. If you have difficulty finding the midline because the teeth are missing, use the incisive papilla as a guideline. The midline of the papilla is the same as the midline between the centrals. Repeat this step for the interproximals between the centrals and the laterals, between the laterals and the cuspids, and between the cuspids and the unprepared first bicuspids. Remove the preoperative model and gently bring the operative model into contact with the lower. With a sharp pencil, extend the pencil marks on the lower model straight up to the upper operative model. Use a Bowley gauge if necessary. These marks on the operative model are the interproximal guidelines. They show the widths of the centrals, the laterals, and the cuspids. Next, establish the overbite guideline. This guideline will show how far the upper anterior teeth come down over the lower anteriors when the jaws are shut or in centric. Place the preoperative model on the lower model again, making sure the models are in centric. Using a sharp pencil, draw a line on the labial surfaces of the lower anteriors along the incisal edge of the upper preoperative model. Draw the line from the right cuspid to the left cuspid. Then, remove the preoperative model. Now, by using the preoperative model, you've established guidelines that define the interproximal perimeters and the incisal length of each tooth on your bridge. In the next step, you'll place the bridge on the model. Before you do that, use an air abrasive unit to clean out the abutments. Make sure there are no porcelain particles left inside that could abrade the dies. By the way, the bridge we're using for this demonstration has been stained so that you can see the contouring we do more clearly. Of course, the bridges you'll work on will not be stained. Now begin. Remove the tissue area and the left contact area from your operative model so that nothing interferes with the placement of the baked bridge on the dies. Make a heavy mark with your red pencil on the mesial of the right unprepared first bicuspid. Place the bridge on the dies until it gently touches the marked first bicuspid. Remove the bridge and note the area of contact, which is indicated by the red mark on the porcelain. You will contour this area so that it comes into gentle contact with the first bicuspid when the bridge is completely seated on the dies. Place a number 14 heatless stone in your handpiece. Contour a flat surface in the marked area on the porcelain. It's very important that you make this flat surface parallel with the long axis of the unprepared first bicuspid. Keep the long axis in mind as you work. Do not grind away too much porcelain at one time. Instead, grind a little, then place the bridge on the model, remove it, note where the marked area is on the porcelain, and contour that area. Repeat this process until there are no more heavy red marks and the porcelain just contacts the first bicuspid. During this process, do not abrade the contact area on the unprepared bicuspid, or the bridge will be tight in the mouth. When you're finished with the right cuspid, repeat this procedure to create the distal contact area for the left cuspid. When the bridge is completely seated on the dies and the margins are closed, go on to the next step. The next step is to establish the tissue-bearing surfaces of the bridge. Replace the tissue areas of the operative model. Use your pencil to make a heavy mark over the entire tissue area. Place the bridge on the dies and tap gently with your handpiece. Don't rock the bridge, as rocking may damage the dies. Remove the bridge and note the marked areas on the porcelain pontic areas. Note how much contouring you'll have to do. If the margins are wide open, you'll want to contour more aggressively at first, but be careful not to grind away too much porcelain. Place a Duragreen IC5 stone in your handpiece and contour the porcelain in the marked areas. Once again, grind a bit, then fit the bridge on the model, tap it lightly, remove it, and contour the new marked areas. Repeat this procedure until the labial and lingual margins are perfectly sealed and there are no heavy marks on the pontic area when you place the bridge on the dies. Check the surface of the porcelain that contacts the tissue. It should be a smooth, flowing surface with no sharp or irregular areas. Whenever you use a small, sharp abrasive stone, the edges of the contoured area will be sharp. These sharp edges will cause natural tissue to become inflamed once the bridge is in the mouth, so they must be contoured to a smooth surface. The next step is to contour the linguals to achieve centric with the bridge in place on the operative model. Place the bridge on the model and close the articulator. Note how much the bite is open by checking the gap between the upper and lower posterior teeth. If your articulator has an incisal guidance pin, you can check the gap between the pin and the incisal guidance table. If the gap between the posterior teeth is very wide, more than a couple of millimeters, you'll need to remove a large amount of porcelain from the lingual area to achieve centric, and so you'll grind more aggressively at first. If the gap is narrow, you'll want to grind more moderately, so that you do not remove too much porcelain and take the bridge out of contact with the lower anteriors. Place a piece of marking paper between the upper and lower models and gently tap the models together. Open the articulator and note the red marks on the lingual surfaces of the porcelain where the lower incisors came into contact. Use a number 14 heatless stone to contour the porcelain where the red marks are. Repeat the procedure of selective grinding, checking with a marking paper, and contouring again until you achieve centric. If the teeth are small, you may have to use a smaller stone to achieve centric. When you achieve centric, the posterior teeth and the incisal guidance pin and table will be in contact, and there'll be gentle contact between the anterior teeth. Now you're ready to contour the teeth to their correct incisal length. Hold the articulator directly in front of you and open it slightly so that you have a clear view of the overbite guideline you drew on the lower anterior teeth. Using the number 14 heatless stone in your handpiece, contour the incisal edge of the porcelain so that it matches the overbite guideline marked on the lower model, but leave the teeth slightly longer than the length indicated by the guideline. This extra length will be removed later. The angle of the incisal tip is very important. Contour the angle at approximately 45 degrees to the long axis of the tooth. This angle allows the lower anterior teeth to slide easily into a protrusive position from centric. Notice that you've now contoured the 4 outside surfaces of your 6-unit anterior bridge. Those surfaces are the left and right cuspid distal contacts, the area where the pontic contacts the tissue surfaces, and the incisal lengths. Notice that you had to change abrasive points only 3 times to reach this point. Make note of your time at this point so that you can check your progress with later bridges. Now, you're ready to begin to define the interproximals. Look at the vertical lines you previously marked on the upper and lower models. Line up those marks and draw the labial interproximal lines on the bridge. If necessary, use a Bowley gauge. Then, open the articulator and extend the interproximal lines to the lingual side of the bridge. These lines must be drawn very accurately because they'll guide you in maintaining the long axis of each tooth during the next contouring steps. Place a separating disc in your handpiece. Starting at the incisal edge, contour along the interproximal line to the gingival margin. Contour to a depth of approximately 1 millimeter from the incisal edge through the middle third area. In the gingival third, contour gradually deeper to a depth of approximately 3 millimeters. You may have to vary these depths to avoid grinding into the metal framework of some bridges. Make the interproximal separations on the lingual side as well, but make the separations only 1/2 to 1 millimeter deep. You've now established about half of the interproximal depth in the incisal and middle third areas, and about 3/4 of the depth in the gingival third area. You'll finish these separations later in the procedure. Now, on the labial surfaces, draw a triangle on the mesial of each tooth. Make the triangle 1 1/2 millimeters wide at the gingival margin and bring it to a point at the incisal edge. Using the separating disc, contour the area of the triangle, rounding the tooth from the labial surface into the interproximal. Do not contour the distals, as that would change the long axis of the tooth. At this point, check the preoperative model. If the separations between the original teeth appear wider, carefully make the separations wider in the same areas on the bridge to achieve the same appearance. Next, you'll contour a depression or concavity in the incisal and middle third areas of the centrals and laterals. Put a number 14 heatless stone in your handpiece. Starting on one of the centrals, make a depression about 1/3 of a millimeter deep through the mesial, incisal, and middle third areas, about 1 1/2 millimeters distal to the interproximal you just contoured. Make another depression next to the first one, but contour only the incisal third area. Do the same on the other central. The total width of the depression at the incisal edge will equal 2 widths of the number 14 heatless stone. If the centrals are narrow, overlap the depression slightly. Now repeat the procedure on the laterals. Because laterals are narrower than centrals, overlap the ground areas so that the total width of the depression at the incisal edge is 1 1/2 times as wide as the heatless stone, or less if the laterals are very narrow. Check your work frequently by wetting the areas you've contoured. Wetting the porcelain gives you a very good idea of what the bridge will look like after it's been glazed. Notice that the mesial and distal lobes of the teeth are beginning to take form, and that the unground reflective areas frame the tooth. Notice also that the contoured areas form concavities, while the outer uncontoured areas are convexities. Now you'll create the distinctive turn of the arch on the cuspids. Continue with the same heatless stone. Start at the distal incisal edge and contour into the gingival third area. Do the same on the other cuspid. Notice that the unground area on the distal of the cuspid forms the distal lobe, while the unground mesial maintains the bold fullness of the cuspid. Natural teeth have a concavity in the area where the enamel of the tooth joins the dentin of the root, which is known as the cementum enamel junction. You'll use a separating disc to create this concavity. Hold the handpiece so that the disc contacts the porcelain as shown. Move the disc in an arc from one interproximal across the gingival marginal area and down the other interproximal. Stay away from the margin itself, and be careful not to grind through the porcelain to the metal framework of the bridge. Make 3 or 4 passes on each tooth, including the cuspids, until you have clear concavities. Create a sanitary seal between the pontics and the tissue by contouring the gingival lingual areas of the pontics. The pontics should contact the tissue only on the labial side of the crest of the ridge, and the area of the pontics that contacts the tissue should be slightly convex. When you've finished, examine the bridge. The unground areas below the curves you just made form the gingival bulges of the anterior teeth. The fine curve at the margin will ultimately blend into the finished margin and the root. This area is now almost complete and is periodontically contoured so that the tissue will return to its natural position after the bridge is seated in the patient's mouth. Notice also the remaining shiny unground areas. They create the mesial and distal lobes and the cervical borders of the centrals and laterals. On the cuspids, these unground areas create the mesial, central, and distal lobes and the gingival cervical border. These convex areas will be the most reflective areas of each tooth and will express the natural shape of the tooth. Note the widths of the centrals, laterals, and cuspids. Contour the mesials if necessary to make the widths of each pair of teeth approximately equal. And finally, have your supervisor or instructor check your bridge for accuracy. This is the end of the first demonstration program. Before you watch part 2, contour a bridge to the point we've reached in this program. We've covered a lot of information in a short time, and you might feel uncertain about some of the steps we've gone over. Refer to the illustrated guide, and be sure you understand each step as you contour your bridge. You may also watch this program again to clarify the process. When you've completed the first stage of contouring and your supervisor or instructor has checked and approved your work, watch the second demonstration program, and we'll show you how to finish the bridge.